Hi, welcome in. How are you today?
Um, I'm I'm okay.
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 Well, my name is Rebecca and I will be working with you today. What's your name? Or what would you like to be called by?
I'm Cora.
Very nice. Really quick, can I just get your date of birth?
6/23/82.
Okay. And then first, before we get into it, I know you signed some paperwork in the office about confidentiality. I wanted to quickly go over that, kind of rehash that. Basically what we say in here today stays in here. You came in on your own, so I'm not reporting to anybody. The things that I have to tell are if you plan to hurt yourself or somebody else. But if it doesn't fall within those lines, then what happens in here stays in here. Did you have any questions about any of the documents that you signed in the lobby?
No, I don't think so.
Okay, yeah, just Duran, it stays here. I know you have your insurance that will be covering this. Nothing goes back to them either. Just us. No questions about that?
No, no.
Perfect. Okay, so what brings you in here today?
Um, well, the last, I don't know, year or so, I guess everyone says it was just anxiety, but um they had to call 911 when I was at work. I could have swore I was having a heart attack. I know I was having a heart attack, and it's just gotten to the point now where my heart just starts beating like out of my chest. I don't even want to go places because I know I'm gonna there's something wrong. I don't know. And I guess if this is anxiety, it doesn't feel like anxiety. I don't know.
Okay, so I hear you saying that you're having rapid heartbeats. You're thinking that it feels similar to a heart attack, and it's causing you to stay in the house more because you're kind of having some social anxiety surrounding that.
Yeah, I guess. But I mean, like I'm getting the chest pain and like sweating and um I've just it feels like more. I mean, I every time this happens and then they check me out, they say everything's fine, but I don't know.
You mentioned every time this happens. How long has this been occurring?
Um, I mean, with the chest pain and stuff like that, it's probably the last couple of months, maybe 3 months,
Okay, three
but it's
months.
not all the time. It's I don't know. It just feels like it's been more frequent the last month. Like it feels like at least once a week.
Okay, so symptoms over the past 3 months. Now, before you started feeling those physical symptoms, did you notice anything maybe before 3 months ago that wasn't physical, but maybe you had like some mental anxiety or you felt it there?
Mm, I mean, I did have, I've had anxiety in the past, probably the past couple of years. But I mean, I was doing fine. It didn't feel like it was anxiety. It just felt a lot different this time. I mean, it never stopped me from doing things before.
Okay. Now, you mentioned that work had to call 911. Do you notice these symptoms occur more when you're at work or do they occur other places as well?
No, it's seems to be at work. Um, and I know my job is stressful. I mean, it's stressful. I'm um just really, I don't know, maybe I took on too much.
What does that mean, took on too much?
Well, a couple of the girls that did the job left and they've been having trouble replacing people. So to keep things running smoothly, I've just been picking up more and doing more, and it just doesn't feel like there's anyone to really help me anymore. And then if I don't get it done, who's going to get it done?
Okay. Now, what age are you?
I am 41.
Okay, so you'd say that this onset of symptoms occurred when you were 41. Okay, that's great to know. Now, when you're in this sort of what feels like a heart attack, are you noticing like how long this symptoms last? What alleviates the symptoms?
Um, I mean, it does seem pretty quick, but well, I mean, what everyone says is quick, but for me, it feels like it's forever, but I guess it's only lasting a few minutes, but it feels like forever.
Now, when your coworkers called 911, did the paramedics come?
Yeah, they did.
Did they take
Yeah,
you to the hospital or were they able to help you there?
they were able to help me there. And then, um, I mean, I was pretty much fine by the time they got there, I guess. So I guess they, that it lasted pretty quick. It was just a very quick episode, I guess. I don't know.
Okay. Now, the next question I'm going to ask may seem a little sensitive, but have you ever had any thoughts or history of suicide ideations?
Mm, no,
What about homicide ideations?
no,
Do you ever think that you see or hear things that aren't actually there?
no.
Okay, good to know. Yeah, again, those questions might sound a little strange, but I am required to ask them. So thank you for your honesty. Is this your first time getting help with this anxiety?
Um, I when I got divorced a couple of years ago, I did talk to somebody about the anxiety. I just had so much on my plate and had my kids full time for the first time, and it was just so much. So I did, and I mean, I've been doing fine.
Okay. And so you said this divorce happened a couple years ago.
Mm.
How many kids do you have?
I have three.
Oh, wow. What are their names and ages?
Um, I have Leanne, and she is 12, and then I have Joe, who is 14, and then I have Mary, who is 16.
Oh, wow. That is a handful.
And
That's a
they're
lot
so
to manage.
busy.
Yeah. Now is their father in the picture at all? Is he helping or
No,
just kind of dealing with it all on your own?
yeah. He's just impossible, so I
Okay.
just take care of it myself.
Are there any other people that you lean on for support?
No, I mean, no, it's just me.
Okay. Now are you from this area? Did you grow up here? Oh, so you're new. Or not new, but
Yeah. No, we moved here for my ex-husband's job, so I don't have any family. I mean, I thought about moving back home, but I mean, my job pays really well, so really I don't think I'll get anything like this back home.
how far is home from here?
It is about 500 miles. So,
Okay, so not too close.
mhm.
Are you currently taking any kind of psychiatric medications?
No.
Have you ever been prescribed those in the past?
Um, Originally they gave me Xanax to take as needed, but I didn't like it. And you know how addictive it is, and people talk about that, and that scared me. So
Okay.
I wouldn't take it. I mean, I did occasionally, but I didn't want to take it.
What about it did you not like, except for other than the addiction part of it?
It's just I guess the addictions. It just scares me, and it kind of does make you sleepy. So like, how am I supposed to do that and like take care of my kids and do my job? So,
Okay.
but
Okay. In the future, are you open to any kind of psychiatric medications?
I'm, yeah, maybe. I'm worried about side effects and stuff, but and safety. I mean, I don't know. Maybe it's something I'd be open to discuss, I guess.
Okay. One more question I have to ask. Have you ever been an inpatient in a psychiatric facility?
No.
Okay. Now let's talk more about your family and your family history. Are there any, or is there any history of behavior, mood, anxiety issues in your direct family?
My mom had like severe depression. Um, but other than that, I don't think anybody really has.
Okay. What about any substance misuse?
Me,
Or yourself or your family?
um, my family, almost all of them use illegal substances and they all drink. I have quite a few alcoholics in my family.
Okay. Is that something you were ever worried that you would struggle with or did struggle with?
It's probably why the addiction to Xanax kind of worries me so much, or taking prescription pills worry me, because um my dad like abused prescription pills and so did my brother. So I don't want to be like that.
Okay. Yeah, that's completely reasonable. Any siblings?
I have a younger brother and older, my older brother and sister are half, so they're my mom's side only.
Okay. Now, when you were growing up, who primarily raised you?
Um, my dad traveled a lot for work,
Mhm.
but my mom, but she was always like sleeping because she suffered from depression pretty bad, so she was always just in bed.
Okay. Okay. Um, any history of military service in your family?
My dad, but not when I was growing, it was before any of the kids were here.
Okay, what about any history with you of verbal, sexual, physical abuse?
Um, no, no, I mean, my household was volatile, like they yelled a lot and they would throw things, but I wouldn't, I don't know if that would make, I don't know.
Okay, that's great to know. Any history of legal problems?
No, the only legal thing I had is just the divorce.
Okay, thank you. And now quickly, we're gonna run through just some basic medical history. Do you have any past or current medical conditions or issues?
Um, no, I mean, I had some surgeries a few years ago, but I'm fine since then. So
Okay. Any non-psychiatric medications you're currently taking?
just hormone replacement therapy.
Okay. Okay. Any history of hospitalizations for non-psychiatric issues?
Yeah, when I had all my surgery, when I had my hysterectomy, there was complications and I ended up with 4 surgeries and I was in the hospital quite a bit during that time due to complications.
Wow, that sounds very traumatic. Um, any histories of head injury?
Um,
Any allergies?
just seasonal, nothing that I know of medically or like medication wise or anything.
Okay. Well, that's it for the medical history. So I'm really glad you came in today, and I really appreciate your openness and your willingness to be honest with me. I know I asked a lot of invasive questions, and I apologize for that, but I really just want to get to know you and get to know anything that could be affecting what you're feeling physically. Now, as summary for what we've talked about, this was more of like the introduction meeting. I think given, that feeling you're feeling and the anxiety and tightness in the chest, I think you would really could benefit for some weekly cognitive behavioral therapy. Have you ever heard of cognitive behavioral therapy?
Yeah, but I'm not 100% sure what that means.
Okay, yeah, it's just a theory that basically, how we think, how we feel, those things are very closely connected, and it's just talk therapy to help you kind of improve with these symptoms. Would that be something that you're interested in?
Yeah, I mean, I'll give it a try.
Okay. And yeah, and I just want to let you know if we start working together and you don't feel like we're really connecting, it's totally fine to verbalize that and to ask for somebody else. Like, we're really here to help you to improve, and I want you to get the best help possible. So if we get to the point where you're finding that maybe I'm not the correct person to help you get there, you're totally free to tell me that.
Thank you.
Do you have any questions about what we talked about today?
No, I don't think so.
Okay, well, out in the front lobby, Jessica will help you schedule your next appointment, but it was really great to meet you and I cannot wait to see you again.
Thank you. It's nice to meet you.
Thanks.